Okay, Dr. Rafich here from Vet Triage. We're continuing through this journal for JAVMA, May 1st, 2014. We're looking at postoperative comparison of 4 perioperative analgesia protocols in dogs undergoing tibial plateau leveling osteotomy. For those who are interested, I do have a TPLO and cruciate disease videos on my YouTube channel. Just search for cruciate or TPLO or lateral suture technique, and you can learn about cruciate disease there. This study comes out of France. The objective is to compare 4 analgesia protocols. It's a randomized, blind, prospective clinical trial, so that's a pretty good one. It's probably the second best type of study you can have. 48 client-owned dogs underwent stifle joint surgery. Right away, I'm thinking that's a low number of dogs. That's going to be a weakness of this paper. That's also a common weakness, as we know from this channel. Tibial plateau leveling osteotomy dogs were treated with either a constant rate infusion of a combination of morphine, lidocaine, and ketamine, or they were given a lumbosacral epidural with morphine and ropivacaine, or they were given both treatments, so a constant rate infusion and the epidural, or they were only given intramuscular premedication with morphine. They used a validated sedation scoring system and a modified Glasgow composite measure pain score to assess comfort and sedation. They acquired these measurements at 1-hour intervals for 4 hours, and then at 4-hour intervals for 24 hours. Dogs with a postoperative pain score of over 5 out of 24 were given morphine as a rescue analgesia. Results showed there was no difference in heart rate, respiratory rate, systolic arterial blood pressure, end-tidal PCO2, end-tidal isoflurane concentration, and vaporizer settings between the groups. No differences in pain score, sedation score, rescue analgesia requirement, or time to first rescue analgesia after surgery was detected. For those who don't know, rescue means that it's a medication that's given in a time-sensitive manner because the pet is exhibiting some sort of symptoms. So the dog shows pain, and then you give the medication. That's rescue analgesia, as opposed to giving analgesia preemptively before they show pain. Conclusions: all 4 groups had similar rescue analgesia requirements and similar times to first administration of rescue analgesia. Introduction: opioids, N-methyl-D-aspartate or NMDA, receptor antagonists, local anesthesia, and nonsteroidal anti-inflammatories are classes of anesthesia drugs. Regional anesthesia techniques like epidurals also provide pain relief. Multimodal analgesia, defined as the concurrent administration of multiple analgesic drugs and analgesic techniques, is a method of providing postoperative pain relief. The modified Glasgow composite measure pain score is validated with multiple indices associated with orthopedic pain, including the patient's overall appearance, observation of gait, response to pressure on the surgical site, and overall demeanor. So for the materials and methods, they used acepromazine, morphine, crystalloids, lactated ringer solution, and isoflurane and oxygen. Dogs were mechanically ventilated at a rate of 6 to 8 breaths per minute and a tidal volume of 10 to 15 mils per kg to maintain end-tidal PCO2 between 35 and 45 millimeters of mercury. Patients were allowed to have nonsteroidal anti-inflammatories at any time during the study. One of the other weaknesses of this paper is the epidural administration. There are ways to confirm that the epidural injection was properly administered. Radiographs can be collected to make sure that the epidural needle is in the right spot, or ideally that plus a nerve stimulating machine or nerve velocity machine. I can't remember what it's called, but it measures the specific nerves that are intended to be numbed by the analgesia. And so you measure the velocity, the speed of conduction for those nerves, the nerve conduction velocity, I guess, to make sure your epidural worked. So they didn't do that in this study. Which probably doesn't matter because all 4 groups are the same anyway, but if you have a low number of dogs, then it can mess up whether or not that's a reliable conclusion to make. Results: most dogs were mixed breeds, then Labradors and Goldens, and others. Duration of anesthesia, duration of surgery, and time to extubation were not different among groups. Duration of anesthesia ranged between 135 to 145 minutes. Surgery duration 58 to 72 minutes. Time to extubation between groups range from 16 to 43 minutes. The maximum possible sedation score is 14. The mean sedation score ranged from 5.2 to 7.8 and was not different between the groups. The maximum pain score possible was 24. The mean pain score between the groups was 2.6 to 2.8 with no difference between them. The median and mean pain score amongst groups were not different over time. Discussion. In this population of dogs undergoing TPLO, the use of multimodal analgesia did not significantly improve comfort compared with an opioid non-steroidal anti-inflammatory combination alone. There was no difference among groups, the number of dogs requiring rescue analgesia, time until first rescue analgesia, mean cumulative dose of rescue analgesia, or mean number of rescue doses given. Some dogs in each group required rescue analgesia at some point within a 24-hour period. In another study, they examined the effectiveness of perioperative analgesia protocols with epidural injection, intra-articular injection, and intravenous injection for TPLO. They also found no differences in measured indices of post-op pain between epidural, intra-articular, and intravenous. But the epidural and intra-articular groups had longer times to the administration of the first rescue analgesia compared with the control group. Another factor they didn't consider here is difference in TPLO technique. There was one surgeon in this study that did all TPLOs, but also how you do each TPLO matters too. Like for example, if you remove too much of the craniotibialis muscle, for example, too much muscle dissection, those dogs tend to be more painful, more lame after surgery, more bruising than the ones that than the techniques where you salvage as much muscle as possible. So again, this probably would be not a non-issue if they had a larger number of dogs for this study. Carprofen was the most commonly administered non-steroidal anti-inflammatory drug. Others include meloxicam, piroxicam, duroxicib, and furoxicib. Several other studies have shown analgesia efficiency of NSAIDs used with opioids. NSAIDs take at least 7 days to wash out, and because these dogs were client-owned, ethically they elected to continue NSAIDs before and after surgery. Having multiple people perform epidural drug administration may have influenced the results, given that they cannot confirm epidural needle placement with radiographs. Methods of scoring pain in animals rely on the observer's interpretation of animal behavior. The scoring system they use has been validated for dogs with orthopedic pain, and epidurally administered morphine has been shown to provide analgesia for up to 24 hours. So yeah, overall solid study. You just want a larger number of dogs and confirmation that the epidural was consistent between those who administered it. But otherwise, I like studies like this. Simple and clean. So, all right, everybody, we'll see you in the next one. Take care.